Hi, everybody. I'm Deb Fournier. I am the Director of Health Law and Policy here at the Institute for Health Policy and Practice at UNH. And we have wrangled some of the time of our New Hampshire Medicaid leadership to discuss open enrollment and special enrollment periods for those who have lost Medicaid eligibility and how it relates to Medicare. So before we begin our discussion, Dave, do you want to say hi to the folks at home and introduce yourself?
Hi, I'm David Chorney, the state's Deputy Medicaid Director, and I've worked a lot on some eligibility and Medicaid policy matters over the past year, especially around the unwinding of Medicaid coverage for those who were protected during the public health emergency.
Great, thank you so much. Let's go to our agenda and just quickly cover what we're gonna tell people what we're gonna cover in our time together today. So we're gonna cover our goals. We're gonna cover our glossary because there's lots of words that are very specific to health insurance that you're gonna hear a lot. It's just good to get them all out so that folks can see them in writing and hear them throughout the presentation. And then we're actually going to discuss special enrollment periods and Medicare. So when we talk about our goals for the day, we want to put it in some context. So Medicaid had continuous enrollment during the public health emergency, and that ended in April of 2023, and it triggered so many changes or transitions in healthcare for many people across the country and for many people in our state. And so the Medicaid leadership in New Hampshire wanted to come together to really highlight other options for people whose Medicaid may have ended, but still need coverage. And we know that one of the groups of people that Medicaid covered were folks that were aging into Medicare. And so we wanted to talk about what some of the rules were around that. So let's go to our glossary. So Medicare is our publicly funded health insurance for people who are 65 and older or who become disabled. It's administered at the federal level. Open enrollment period, that's an insurance term that means a specific point in time every year when a person can purchase and apply for health insurance for the upcoming year without any other event happening. But another event could happen. Those are called special enrollment periods. And that's a time outside that special open enrollment time when a person can sign up for health insurance after some kind of big life event. It's usually, a new baby or a new marriage or moving or adopting a kid or welcoming someone else into the household. So those are the ideas that we want you to remember, because we're going to be talking about them a lot as we go through our discussion today. So can we go to just what is Medicare? And this is where I'm going to turn it over to the experts. Dave, can you tell folks a little bit about what Medicare is and what it covers and for whom?
Yeah. So Medicare is a federally administered health insurance program for individuals 65 and older. There is some coverage for people under 65 for younger individuals with disabilities or individuals with end-stage renal disease, but the majority of individuals covered by Medicare are 65 or older. And Medicare includes a couple different parts. There's what you'll hear as original Medicare, which is parts A and B. And parts A is really hospital insurance. So it covers your inpatient hospital stays, some skilled nursing facility stays, some hospice care, and some home health care. And part B is more of your traditional medical insurance. So that covers your doctor services. So when you go see the doctor, or outpatient care, medical supplies, preventive services. And prescription drugs are covered under a different part of Medicare that's called Part D.
Okay. And then, we hear a lot about Medicare Advantage or private Medicare plans. Can you talk to us a little bit about what's known as Part C?
Yep. So Part C is kind of a bundle of parts A, B, and usually Part D. But instead of it being fully administered by the federal government, it's administered through a private company. So a private insurance company, and it's an alternative to the original Medicare, so parts A and B. So it'll cover your hospital stay, your physician stays, but it may have a different network than traditional Medicare. There may be some coverage limitations that are different. But some of the plans, the Part C plans, also may have lower out-of-pocket costs than original Medicare. And some of them offer some additional extra benefits that Parts A, B, so original Medicare doesn't cover, like vision, hearing, and dental.
Right. Okay, so if someone is trying to start Medicare, can we talk a little bit about like their open enrollment and how that traditionally works for people?
Traditionally, Medicare, similar to private insurers or the federal marketplace, where you could get a qualified health benefit plan, there's an annual open enrollment period. And so for calendar 24, this started in October 15th, October 15 and went through December 7th of 2023. And so in this period, starting on October 15th, if you were 65 or older, you could enroll in Medicare. It also allows people to not only start their Medicare coverage, but switch their Medicare coverage.
So if I didn't like if I had the original coverage, the A and B, but I wanted one of those fancy Medicare Advantage plans, that could be the time of year when I would make that kind of change.
Exactly. And there's also a special initial enrollment period because not everyone is 65 between October 15th and December 7th.
Right.
So if you turn 65 in June, you'll have an initial eligibility period, and the initial eligibility period is 7 months long. And it begins 3 months before you turn 65. It includes the month you turn 65 and then 3 months after you turn 65.
So there's lots of opportunity there also.
Yep.
Yeah.
The key thing to remember is if you don't enroll during your initial eligibility period, you could be subject to lifetime penalties or late fees, and it's 10% of the monthly premium for each year you were eligible for Medicaid but not enrolled.
Okay, so can we talk about that? What does that look like? And why would that happen? Why would they penalize people for not using the service? Why would they, be like, hey, you got to pay more because you didn't sign up when we wanted you to, or when you were first eligible?
And it sort of goes back to the fundamentals of how insurance works. Insurance is, you can think of it as a giant risk pool. And so if you're not in the pool, the risk isn't baked into the premium costs that the insurer incurs. So if you were to get sick and then enroll, the insurer just has to cover, the risk part, but they don't get to benefit when you are healthy. So insurance generally just works best from a stability standpoint when as many people as possible are enrolled for as long as possible, because it spreads the risk around a bit more equally.
So it's important to sign up when it's your time to sign up. And as you can see on that slide, the financial penalties, they can really add up, right? Like, that's not nothing money for someone who might be on a limited income or really watching, right, what's going in on a month, coming in and going out on a monthly basis.
Yeah, and they add up over time too. So you can see, for 12 months in this example on this slide, it's about $2,700, 2 years, $5,500, 4 years, $11,000. So they keep increasing the longer you're eligible but not enrolled in Medicare.
Yeah. So is there any way for folks like to avoid this? So we know there's open enrollment and we know there's their initial eligibility period. But why are we telling folks who may have lost Medicaid about this?
There's a special enrollment period for individuals that have lost Medicaid, and it would allow them to enroll a special enrollment period that's outside of that annual open enrollment period or your initial enrollment period to enroll in Medicare and not incur those potential late fees or penalties. There are special enrollment periods for things outside of losing your Medicaid coverage. For example, an emergency or natural disaster, misrepresentation by an employer or former group covered insurance coverage that you were covered under an insurance plan. But we're here today to talk about individuals who were on Medicaid, which doesn't have open enrollment periods or financial penalties, but have now lost their Medicaid coverage because maybe they're no longer eligible and need to enroll in Medicare.
Okay, so how long is this losing Medicaid open special enrollment period for Medicare? How long does that last?
So it starts when the individual is notified that they've lost their Medicaid coverage and ends 6 months after the termination date of their Medicaid coverage. And this is for individuals who have lost Medicaid coverage on or after January 1st, 2023.
Okay, so if someone loses their Medicaid coverage, they get the first letter or the first notice that they're losing their Medicaid coverage in June, then
their special enrollment period will run through the end of December. But say you lost your Medicaid coverage last month in May, your special enrollment period will run through November.
Okay. And if folks need help, like if they need a hand, because this all sounds relatively complex, or at least like there's just a lot of moving parts. Where do people go to get a little bit of help?
You go to the New Hampshire Department of Health Insurance or DHHS website. You'll see links to ServiceLink, which is a resource center for individuals that, and they can also help with re-enrolling in Medicaid if you're still eligible, or enrolling in Medicare. And we also have a couple of really great navigator groups in New Hampshire, and they can help with enrolling in Medicare, re-enrolling in Medicaid, or say you or a family member or a friend isn't Medicare eligible, but could qualify for a benefit plan through the marketplace. They can help with that as well.
Great. So if you are trying to sign up for Medicare, ServiceLinks can help you out. DHHS can help you out if you're trying to find out whether or not which coverage is available to you. Navigators can help you out. This is all great information. Dave, I just want to really thank you for both your time and your information today. And I know that the people watching, that this is helpful for them, no matter which health insurance transition they're going through. Thanks for joining us.
No problem. And thanks for organizing, Deb. This is a great topic.